Hi, Marlise Perez, DHCS. And so we're very excited to have Assembly Bill 848 pass and was enacted in January. And so what this proposal is requesting is for 4 staff to implement the provisions in 848. So what 848 does is allows a residential provider, if they choose, it's voluntary, but for them to add a service designation to do incidental medical services. And so, because prior to this bill, our services were strictly non-medical. And so really what these incidental medical services are is to enhance someone's ability to achieve long-term recovery. It's not any type of physical health services, so if you break a bone, you still need to go to your primary care doctor, but if it's in relation to your recovery, especially through the detoxification process. So what the department is requesting is staff to process the applications, because it is an application if a facility wants to add this service level, and then to monitor the facilities that choose to apply.
LAO, Finance, public comment.
Adrienne Shelton from the County Behavioral Health Directors Association. This was one of the bills that we co-sponsored last session, and we're very supportive of this request by DHCS to have the resources that they need to help implement. Thanks.
Thank you.
Helene Meshar, California Association of Alcohol and Drug Program Executives. We believe that the resources that are there are sufficient, but not sufficient enough, that the licensing for this particular function in this category will require a higher level of knowledge and ability, and would think that there would need to be more staff at a higher level of service to do the evaluation of the licensing for the medical staff that would be in the facilities. So we would ask that this be looked at, and we've discussed this with the department, and we would ask that maybe another look be taken at this. Thank you.
Thank you very much for that suggestion. All right, it's time to make a transition here. Thank you. Item 4260 and 4560, Department of Healthcare Services and the Mental Health Services Oversight and Accountability Commission. We'll start with issue 1, oversight of the Mental Health Services Act and outcomes evaluation, page 33 on the agenda.
This is Karen Baylor with the Department of Healthcare Services. I think, oh, my brother's joining me. I think you've heard through this conversation about the oversight and monitoring that we've done, especially within the triennials. We have added in several questions into the triennial protocol to look at how counties are dealing with their planning process, their stakeholder participation, looking at the full service partnerships, and looking at issue resolutions and logs. Most importantly, we've started under our audits and investigation unit, have done fiscal audits their first year. I think they only did 2. It took some time to develop a protocol and get it so that it is workable. Last year they did 10 audits. They do their audits based on a risk assessment performed by the Audits and Investigation Unit, or if there was a referral. There's been a couple of referrals that have come through from ANI, and they're very labor intensive and take a long time. And so why we would like to conduct more audits on the cost reports and MHSA funds. We are limited at this point because of the amount of time it takes to do those audits. On the county's reporting for the revenue and expenditures, we did an information notice that said that their 13-14 revenue and expenditure reports were due by October 30th of 15. We've had 37 counties have submitted their RERs, which means 22 counties have not. We have sent letters to the 22 counties. Recently, we did receive a letter from the County Behavioral Health Directors Association expressing concerns about the template that is used to report the fiscal and financial information. We have been working through that, and we'll be providing some clarification very soon so that we can get the RERs. Why does it take 3 years to report it publicly? Counties are required to submit claims within a year from providing the service, so there's always that year lag. They are required to submit their RERs by December 31st following the close of the fiscal year, and then we need about 6 months to review and work through any questions we have on the reports. So you're looking at 2 years right there. There were a couple of reasons why we've had some recent delays. One was that the template was not released on time because we were working with the OAC on some changes to the reports. And the second cause of the delay has regarding the part that I mentioned earlier on receiving the letter from CBHDA on getting clarification. And some of that has to do with how to look at reversion or funds that are possibly eligible for reversion. So we will be, once we have all that work finished, we will do another information notice to provide some clarification.
And so once the template is corrected or
Cleaned up, we'll send that back out.
And so then we won't have, so then the 3-year process will be shortened because structurally you will have made some changes.
Correct, but we'll still have a 2-year process.
I got that part in terms of their full year lag and your 6-month plus opportunity to look at their data, okay?
Okay. In regards to auditing the performance contracts, we really have not done a good job in auditing that. We have not had the resources to provide that level. We do have some ideas on how we can conduct this further, but we recognize that this is an area where we have not been able to audit like we would like to.
And what's the downside of that from your perspective?
Well, we should be auditing, and it doesn't give us a
What's the risk? Let me reframe the question.
What's the risk? The risk is, at this point, that we don't know what's out there and what's being provided in a clear and transparent way, as you heard from some of the stakeholders talk about earlier today. We have gotten a number of complaints from people out in the local level where they don't feel as if the right population is getting the right access to services. When we do get those types of complaints, we do take those very seriously, and we'll go out and send a team out to actually do an audit to see if there needs to be some plans of corrections. But we're only able to send people out when we've received the complaints. And so it does cause us some concern not to be able to audit to the full extent that we would want. But financially, the cost reports are being audited on a regular basis, and we do have some components within the triennial protocol that we look at. So it's just a matter of auditing the performance contracts.
That sounds pretty big to me in terms of, I am sure you're auditing the financial piece, but in terms of are the right people getting the right services at the right time piece, the programmatic side, is this something that you think you'll be looking to ask for budget augmentation for in the near future?
Yeah, I think we would have to take it back in terms of, we would probably want to know how many complaints we get in a year. And so some of the, both the data that we've been talking about through all these different systems today, I think when we sit down, as an administration and craft our budgets going forward, I think we tend to try to look at the areas that are the most either fraught with risk or are they really rising to the level in terms of a prioritization of resources. Right. I think this one has been
a little different lens.
It's a little bit different lens. Yeah. And so I think when you look at all the different things that we are trying to do across both the mental health and substance use programmatic areas, has this risen to the level of we need to put resources on that instead of this? I think that has just been, in some cases, a little bit of a judgment call. And I think, again, we're always looking to kind of strengthen where we can, put a hook in, and kind of while we're already there for something else, we'd like to use those resources and not duplicate. So in some cases, it's highlighting an area where, sure, that could be done, but we also are, trying to make sure that we're hitting the other areas that are certainly more pressing. So it's an ongoing conversation. And then the last thing is just the regulation package.
Oh, and then on the regulation package, we are working through that with our internally and with a number of attorneys, and we anticipate that that will be done this beginning of this summer. And the last one is the
It will be back from legal services by summer.
well, it's an ongoing conversation, so it
Okay.
isn't back. It's
It's all within the department, so I think the attorneys sit with the program staff, and so I think what we've been doing is sharing drafts back and forth. I think when we say by summer, that's something that we would like to be releasing publicly by summer.
Got it.
So it wouldn't
Got
be
it.
coming from legal. Yeah.
Got it.
And then on the issue resolution process, we do monitor how many complaints that we get. It's not a very high volume, but we do look for themes, and just a couple of the themes that we've noticed is what, like I said before, clients get the appropriate level of care or the level of care that they would desire, lack of county stakeholder engagement, improper use of MHSA funds that happens within some of the housing. Did you really use this for the criteria that you set out for in your plan? And potential conflict of interest in awarding Mental Health Services Act contracts. So those have been kind of the themes of the complaints that we've had over the last 10 years.
And you said not a high volume.
Not a high volume.
Okay.
Madam Chair, thank you. I'm Toby Ewing. I'm the Director of the Mental Health Services Oversight Accountability Commission, and I have with me Norma Pate, one of our Deputy Directors. Thank you very much for the opportunity to come and talk with you. And in terms of this very broad question, I wanted to kind of give you a high-level overview and then be able to give you some of the specifics as some of the questions come up later on the agenda. As noted in the analysis, the Commission, since we came here about a year ago, have been working to try to develop the fiscal transparency that the legislature has asked for, that was highlighted by the Little Hoover Commission. I think the BSA also had raised that. And what we have done over the past few months was we've gone out and developed a tool that will allow anybody in the public who wants to look at where the money comes from, how it gets distributed to counties, how it's broken down into the various components of MHSA, and then how much has been spent, not how it's been spent, but how much has been spent, with the intention, in responding to the concerns that were raised by Mr. Selix, to allow anybody who wants to see how much money is remaining in county coffers. We've built that tool, and we've started to input the data, drawing heavily upon the revenue and expenditure reports produced by counties in response to the templates that DHCS has put forward. And when we've given that information back to the counties, they've raised a number of very significant concerns. It's a very complicated kind of issue, but one of the counties put it pretty well. She said that the RERs are more like a checkbook register. It's a point-in-time impression of how much is in your bank account, recognizing that there are many checks that haven't reconciled, and many checks that there's no amount was ever written in because we have not figured out how much is owed in a certain instance or whether or not there's reconciliation with Medi-Cal. And so the lag in terms of reconciliation really makes it hard to answer the question of how much money has been unspent. In talking with the counties, however, many have shared with us that they have put their financial information on their own websites, and that in some instances that information doesn't reconcile with the information that the state has because of the way in which reporting is required. So the commission has put forth a project where we're sitting down with the department, with counties, with others, with some financial consultants to really roll up our sleeves and understand, are there ways that we can create reliable and valid understandings of, certainly on the revenue side, that should be easy. The expenditure side, there's some areas where it should be relatively clear, and some other areas where there's some uncertainty. And so our goal is to at least convey very publicly in an open data format on our website what we do know and where there's uncertainty. In particular, one of the issues that counties have raised is because of the sometimes 3 or 4 year lag in reconciliation around Medi-Cal expenditures and reimbursement rates, that there are some areas where there will be some reconciliation. But we're confident in the discussions we've had with the counties is that they're very willing to work with us on that. They recognize the value. We think we can get it done. We're not necessarily confident that we can be 100% valid and reliable in terms of all the dollars, but we certainly don't want to encourage confusion between what the state is able to report and what counties are able to report on their own websites. So that's part of your question really is, how are we really understanding how the dollars are being used, right? The second part of that is a little more complicated, which is, where's the money going? And so we actually are also trying to develop tools that allow us to report publicly around the kinds of expenditures that counties have in terms of the services that are available. And that's probably going to take a couple of years because there's so much variation county to county. That's both the strength of the Mental Health Services Act. It allows counties to really tailor their strategies, but it also makes it hard to get a statewide picture of what's happening with these dollars. The third part of what we're trying to do is actually then be able to report out on the kinds of outcomes that we're achieving with the dollars and those programs. That's going to take a little bit longer. Under the master plan that the commission has adopted, there's a recognition of the need to really talk about outcomes at the individual level, at the system level, things like lags in getting services or access to care, but also being able to talk about community level outcomes. And so the commission is working with the department, with the Department of Justice and some other state agencies to really begin to understand how we can leverage existing administrative data sets to really identify population level trends across the state for the high-level outcomes that are identified in the Act. Suicide, criminal justice involvement, homelessness, unemployment, school failure. Some of those are easier than others, but we're working towards an environment where we want the public to be able to understand where the money came from, how it was spent, and what you got for it in terms of those outcomes. As part of that, and along the way, in addition to those sort of broad data pieces, the commission is pursuing a number of projects where we're really drilling down. One of them is looking at fiscal transparency, particularly reversion policy. The law says that if counties don't use these funds, it should revert. It's been some years, I think, since 2008, since funds reverted, but we've seen in the press and elsewhere that there are counties who are not utilizing all of their Mental Health Services Act dollars. So in partnership with the counties and with the department, we're again looking at what's the policy, what's the practice, and how do we make this work. In addition to reversion, we are, your question 6 around the issue resolution process, we have a project underway. It's led by one of our commissioners who's a consumer of services. We met, I think, 2 weeks ago and began to talk about how that project works, what's the role of the state, what's the role of the counties, and one of the things that we're finding in LA County, for example, we asked them, because they have a local issue resolution process in addition to the state level process, how many of your consumers or residents have utilized the issue resolution process in your county? And they're telling us it's about 4 per year, very, very low. And so we've asked, out of 10 million residents, how reasonable does that sound? Correct, Senator. It doesn't sound reasonable to us. And so there's the potential that the issues are being resolved prior to getting to that level, but we're starting to ask this question of the counties and really working through, is that system as robust as it needs to be? And that's where the commission is starting. We're also looking specifically at the criminal justice involvement of consumers under the leadership of Sheriff Bill Brown, one of our commissioners. And we're looking at the intersection of mental health in the schools. These are 10 to 15-month kind of investigations. We're holding public hearings. We're doing site visits. We're convening community forums, advisory committees, and we're really trying to look at the policy, the practice, understanding what's working, are there models, where are the incentives, how do we really move California's mental health system towards the outcomes and the transformational change identified through the Mental Health Services Act.
And what will you do with that? That sounds like it's going to be very rich data. What will then become of it? How will you enlighten us all?
Sure. So later on in the agenda, you ask about our Children's Crisis Services Project, for example, and so we're preparing draft reports. All of this is done in public that will include very specific recommendations. If the challenge is statute, the recommendations would include proposals for the legislature and governor to consider around statutory change, policy change, fiscal practice. You know, we are trying to identify the things that are challenging and models that are out there and steps, whether it's internal to the commission or the department or the counties, to really try to move California to be best in class.
Thank you.
There's more, but I'm happy to leave that to the other
sections.
Yeah, it's been a long day.
LAL. Finance. Any public comment? And there is some.
Good afternoon, Madam Chair. The lack of information on the issue resolution process and other oversight mechanisms has been a serious and ongoing concern among local and statewide advocates. The lack of a volume in complaints via the IRP seems to be a red flag to me in such a large state. We support the OAC's continued work examining the issue resolution process and support a more robust and transparent oversight mechanism. Thank you.
Would you mind identifying yourself, please, for the record?
Yeah, I apologize. Michael Helmick from RIMCO, the Racial and Ethnic Mental Health Disparities Coalition.
Thank you so much. Next witness.
Rusty Seelix, California Council of Community Behavioral Health Agency. I just want to start that this subject, every time I speak with Mr. Steinberg since we wrote this act, this subject comes up as a complaint that we don't know where the money is going.
He has raised it with members of the legislature as well.
Pardon me?
And he has raised it with members of the legislature as well.
I think it's very refreshing to hear Mr. Ewing and Ms. Baylor and others speak about the fact that we're finally going to tackle it. But I also think that on this 2-year lag, even when you get these revenue and expenditure reports, they don't tell us anything that's particularly useful in terms of right now, because it's so old, and it's not the details. We need to know where every dollar is going. So my thought is what we need to have is kind of what the legislature has at the local level, a transparent process every spring where the county puts together its budget of everything they're going to spend, what they've spent in the past year, and what it's all gone for, and you can see it all, where it's all there, not just the Mental Health Services Act, but all the funds, because the biggest complaint I'm getting, and I get this more this year than ever before, is the state consultant, a man named Mike Geis, shows that the revenues that county mental health has gone from $5 billion to $7 billion in the last 3 years, and yet there's no evidence that very many of the counties have significantly expanded services. As earlier parts of your point are showing, the penetration rates are not going up, they're actually going down slightly. Something's not right, and where is that money? What is it being spent on? We don't have a system at the local level or the state level to get the answers to that in a timely manner. So I would ask that we not only fix the revenue and expenditure reports, but we come up with some kind of reporting mechanism so that in real time, so that every spring, as every county is developing their spending plans, and I'm sure they have it, and I'm sure they say it's publicly available, but we have trouble finding it, and then send it up so that we get current information as to past year, current year, and budget year, where all the money has been, how much they think they have, and all the things they plan to spend it on, because that's what these folks need to be able to do the job, and they don't have that, and the stakeholder community doesn't have that, and without that, we can't even then begin to talk about whether the services are working or not. So hopefully they have the power to develop those kind of reports. If not, then I think they need to ask for that power from you so they can develop those kind of reporting mechanisms. Thank you.
Any response, if you so choose?
Well, I think Mr. Seelix is expressing the sentiments that are consistent with the commission's sentiments. And so when the Little Hoover Commission came out and issued its report about fiscal transparency, the commission endorsed that and has tasked us with trying to make that happen, and so we are putting that together. I mean, I do think that we're finding lots of challenges, as expressed earlier, around some of the templates and some of the reporting requirements, and we need to move this to a higher priority. Now, in terms of the issue of whether or not the state has, whether it's the commission or the department has the right kind of statutory authority to do the job, I'm not convinced that the problem is statutory authority. I think it's, now it may be that as we get to this process, we may come to you and suggest some ways in which that authority, those tools, as Mr. Seelig says, could be enhanced. But right now, what we're trying to understand is, why is this so difficult when it really should be relatively straightforward?
Right. And what's your time frame that you think that you'd be able to present in some format, and you could say, we have achieved some level of transparency. We know where X percent of the dollars are going.
Sure. So we've built the tool that actually, and happy to showcase that. The problem is that when we've typed in the official numbers, the numbers that have been certified in some instances, the counties have sort of blanched and said, oh my gosh, apples and oranges kinds of comparisons. And so in terms of having the sort of 100% coverage, all of the counties, all of the years, that's going to take some time. We're at this point where we are trying to see if we can, by working directly with the counties, get enough information that is reliable and valid enough that we can put it out there in ways that will create the kind of political will for other counties to come on board in terms of some of the release. Now, but we also recognize that they face some challenges themselves, in part because of challenges with the template or the ways in which there are different numbers that are floating out there. And so I think the good news is that between DHCS and the counties and ourselves, there's agreement that this is the right thing to do. We want to do it quickly. Now, how far we can get in the next, I'm hoping 3 to 5 months, that we can at least have a majority of the information out there for the majority of years. Ideally, we like to go back to 2004, but as we talk with our financial folks, they're suggesting that the farther back you go, the less reliable it is. Right. So it's a question of your tolerance for error.
And perhaps prioritizing, setting up the infrastructure so on a go-forward basis. We're not in this position where we're trying to recapture history.
That's correct, and I would forecast that as we look at reversion and the way the policy is created and the fact that we haven't had reversion since 2008, but the statute requires 3-year reversion, that we may come to you and recognize that maybe we have to sort of grandfather in some prior practices and do the very same thing in terms of moving forward, because to actually unpack all of the things that should have happened could just not be worth the time and money.
Right, exactly. Thank you for that. Let's move to issue 2, page 36 of the agenda, the Children's Crisis Services Capacity Development Grant Program.
Thank you very much. So early last year, the commission, in response to a number of news stories and other concerns, decided to look at access to crisis services for children and youth. And since that time, we've been meeting with lots of subject matter experts. We've held hearings in Southern California and Northern California with consumers and family members. We're really trying to understand the system that's in place. We've also been identifying models around the country, as well as models here in California. As noted in the analysis, we've prepared a staff draft report that's identified some key challenges and some key opportunities. And in that report, we found that, as sort of cited in the analysis, and I appreciate all the time and energy that your staff has given us over the year, that there are some wonderful things happening in California, but there are some very dramatic failings. We heard testimony from a father in Santa Barbara who said his preteen daughter was put on an ambulance to Sacramento by herself and spent a week in Sacramento alone. I think he said she was 11 years old. And he was not able to go with her or support her or see her for that week. And when she came home, she was just brought home. There was no handoff to services after the fact. So although the commission has not finalized this work and has not adopted these findings and recommendations, in terms of the broad issue of the work that we have done and recognition of some fundamental challenges around access to services for children who are in crisis, particularly opportunities to prevent the escalation of crisis, to prevent future involvement with future need for crisis-level care, there's a lot of work that could be done. One of the things that has come up, came up early last year when I joined the commission, was whether or not the original SB 82 grants, the triage program that's later in the agenda, if those dollars are available for children's services. I think there was a broad perception that they were not, but there's no prohibition in the statute or in the program for that, and in fact, a handful of counties have used those dollars for programs for kids. So I think in terms of the feedback, in terms of the proposal about finding resources to expand grant opportunities or expand services to deal with children and youth in crisis, it's very consistent with what the commission is finding, but recognize that we have not actually taken a formal position as a body.
And will you?
Yes. Yeah. We were hoping to have this done around July, but it's probably August, so your time frame is a little bit ahead of us, but I think that's okay.
Okay, LAO? You didn't do this, oh, yes, I'm sorry, before I go to LAO, DHCS. Your response to number 3 on the questions. If you have any feedback on or comments on the proposal.
We don't have any comments.
LAO? Finance?
Thank you. Carla Castilla, the Department of Finance. We also don't have a position on the proposal, but as your agenda notes, the revenues will be updated in May, and we will always caution that this is a volatile revenue source, and they can fluctuate by hundreds of millions of dollars between cycles. But there is an opportunity to look at some of the recent grant proposals for kind of lessons learned on how you might structure any new program.
As long as you don't spend these dollars some other kind of way and then revise, just look at this first, then.